So do I need to be on Skype then? Because otherwise you're not gonna see.
Nope, we can see that. Because I can get it,
Okay, because I wirelessly connected to that.
okay.
So I reached out to. Yeah, sorry. So I reached out to Megan
Okay.
from EMC, nothing today.
So yeah, I mean, by Monday, we're just gonna make up stuff.
Throw numbers. I know, I understand that. Yep.
We're to,
I told her we needed it by Friday, so.
okay. Oh, good, Netflix.
Yes, we can watch that if you want. Got something good on there?
I'm sure I do. Got good recordings. So I can do the Zooms, but I don't know how to do the solstice things.
How you want it?
How to do the solstice thing, so that way it can connect to the display.
Can people see into the room if they're on Zoom?
Can, but it's, you know, it's a normal picture where it's not great. Oh, you want to see this?
Oh,
So he's looking at the presentation, ain't gonna be there.
okay, can I press the button?
You better press now.
I do. I pressed the button.
Aren't they all pushing buttons? They all push buttons, don't they?
Okay.
Okay, we're done, yeah.
You've done it?
I think that's like this. There's like a solstice an option like that.
I think that's it too.
The absence of knowledge. Nice.
So one of the goals for 2025 will be to make a manual. Depends how you use the TV. And then these people can listen. I mean, you guys did it for the first listening session.
We were waiting.
Yeah,
The right way.
yeah. with the-
Yeah, we did. That we did. So you gotta go to remote access.
That's what I was informed. So-
So go to remote access again. I'm not tied into
Oh, here.
HDMI. See, and I can't get my computer. So I gotta go through the Skype meeting.
Let me see if I can get this.
Yep.
Has anyone joined remotely?
And then I'll share my screen. Like I would normally, yeah. There's no meeting set up for this still.
Yes.
Was there? I don't have it on my calendar.
Maybe I didn't share.
Could be. I got my own meeting assignment here that I put in. That's one that I put in. I got the joint.
should I
review
email
board.
you the link?
Yeah, email me the thing and then I'll jump into it.
You know what, Dan had a problem with it too. For the planning commission.
Yeah, and I couldn't hook up the HDMI tonight on there. It would not fire up the HDMI on there, which is weird. You
Okay,
should be able to go directly to it, but
okay. One, nine, two, one away. Dot, 168. Dot, 13. Dot, 157.
I recognize it. Same thing, so when it authenticates it.
Well, should we carry on?
Yeah. Here it is.
6 o'clock.
it is.
Remember when you connected, but at the beginning.
Give me 1 second. reset again. Sometimes, sometimes. Sometimes. Okay. So I don't know, maybe you want to turn your chairs a little bit so you don't have to twist your neck. Because we will be
there.
Yeah, so do I. So, so welcome. My name is Brian Weicker. I'm the fire chief here in Fredonia. Been on the department since 1996. Prior to that, I was a volunteer over in Wabica Fire Department for 7 years before I transferred to Fredonia because I moved. I live on just off of Highway 57 by the dog kennel up on Hickory Grove Road. I'm just to the west. So that's where I've lived for the last since 1996. So prior to that, like I said, I was over in Wabica for a while. So I've been here all my life. Third generation fire department member here in Fredonia. My grandpa, my dad, my uncles were all part of it. So. Okay, little bit about the paramedic program, or a little bit of history, I guess, first of all, on EMS, Emergency Medical Services, so our ambulance here that we have in Fredonia. So prior to 1974, the EMS services, or emergency medical services, were provided by Port Washington Fire Department. That was volunteers that were based out of Port Washington. They drove a station wagon, which was the ambulance at that time, and drove it out here for our ambulance. That's how we got our first aid. That's how we got to the hospitals. In 1974, there was a group of people here in Fredonia that said enough is enough. We need to have our own ambulance here in Fredonia. And they formed the Northern Ozaki Ambulance. The Northern Ozaki Ambulance took care of the village of Fredonia, the town of Fredonia, and then also the village and town of Belgiums as a whole. In 2000, the Fredonia Fire Department and Northern Ozaki Ambulance were housed in the same building. We had the same exact members. They were always dual members. And we just said, okay, enough is enough with this. We're requiring dual training. We're out of the same building. We said to the village, let's just absorb the ambulance and be done with this. So they became a village of a village department, Village of Fredonia department. So they became part of the fire department then. So there's a couple different levels of our people that serve on the ambulance. There's the lower level person, which is an EMR, emergency medical responder. Just some ideas here of what they go through for training. They do 56 hours of training at a technical college. And then when they're done with that and they pass the class, then they get the opportunity to pass with what's called a national registry, which is a national level test. And then after they pass that, then the medical director, which is ours is out of Aurora and Grafton, the medical director will do a skills assessment of them and just make sure that they're up to par and ready to start treating patients. The EMT, the emergency medical technician, their training is 180 hours at MATC or at MATC, it's a weird display there, but at MATC, plus they have to do 12 hours of clinical time. So that clinical time is in the ER or in the back of our ambulance that they have to be with patients and treating patients. They also have to do that same testing, the National Registry, and then do the medical director as well. And then there's an advanced level emergency medical technician. The prerequisite is the 180 hours that you saw above and all of that stuff. And then they also have to do, now they have to do, to be an advanced level 1, they have to do 120 hours of training at MATC, and then 20 hours of additional clinical time. Again, in the back of our ambulance, but we're at the hospital, typically done in the ER setting. And then they go through another National Registry test and a medical director skills assessment. Once they get that all done, then every 3 years, they have to go through recertifications. Each one of those different levels have to do 3 hours of recertification every 3 years. So again, CPR renewal is part of that. That's every 2 years, actually. And then we go into the technical college piece of it. It's 18 hours for EMR. For EMT, you jump down, it's the CPR, and then it's 30 hours at MATC or LTC. And then there's advanced level EMT, which is 48 hours of additional training every 3 hours that they have to do. Now, on each one of those, I have a little piece there that says training through medical director. So that's an or on that. So right now, what we do here in Fredonia is we train every third Tuesday of the month for 2 hours at our station, which allows our volunteers not to have to go to MATC and spend their Saturdays and Sundays there. They do it on a Tuesday night. When we do our normal training, they get credit for it. We're killing 2 birds at one stone. We're giving them the training that we need to do here. And then we also cover the state's licensing requirements for recertifications. Ambulance staffing requirements. So state of Wisconsin requires every ambulance in the state of Wisconsin to have 2 people on it. One has to be for our ambulance level, it's an AEMT, so an advanced level EMT. And then the second person could be any combination of the AEMT, the EMT, or the EMR. But the state requires 2. Here in Fredonia, we run with 3. We run the AEMT, which the state requires. We run that AEMT, EMT, or EMR as the second person in the back. And then we put a person up front as a driver. That having 2 people in the back gives better patient care to everybody. And it's also for safety of our people as well. Sometimes patients get just combative in the back, but we take care of that with having 2 people in the back then. Our volunteer numbers. So in 2017, we had 17 EMRs or EMT, AEMT staff. We had 11 of them that were A-level staff. Remember, I highlighted the green there, highlighted the AEMT staff because we're going to come back to that. 11 of those AEMT level staff in 2017. 2024 here currently, these are July numbers. We have 15 EMR, EMT, or AEMT staff. 8 of them are the A-level staff. And then we have 10 drivers. Just kind of where our membership comes from for our volunteer department here in the village. We have 6 of the EMTs are from the village of Fredonia, 2 are from the town of Fredonia, 4 from the town of Saukville, 1 from the town of Belgium, and 2 are from further away. So that's the composition of our volunteers right now. So they're not all village of Fredonia residents. Just wanted to make you aware of that we are drawing from outside of our village here in Fredonia. The department membership on the right, which is our firefighters and everybody included, we have 15 from the village, 5 from the town, 9 from the town of Saukville, 2 from the town of Belgium, and then 4 of them are from farther away. Call volume, over the last 10 years, we had 232 calls back in 2014. This year, we're projected to be 456. So in the last 10 years, we've doubled our call volume. So just looking at some data from 2022, we had 432 ambulance calls in 2022. 173 of them were paged as paramedic level incidents. So the county, the 911 center, when you call 911, they ask you a series of questions. Some people get frustrated and they want to hang up the phone because all I need is an ambulance, right? Well, they're asking you questions. They're following an algorithm or a flow chart to determine what level of care do you need. Do you need a paramedic or do you just need a basic ambulance, an EMT coming with the ambulance? So of those 432 calls that we received, 173 of those were paged for paramedic level were paged as paramedic level incidents. So that's 40% of our call volume that we needed a paramedic at. These 173 calls back in 2022, I used 2022 because we didn't have a paramedic at that time and in that year. But those 173 calls, we had to rely on Port Washington or Saukville Grafton to come up, or potentially Deansville, Mequon to come up and be our paramedic. If you look at those response times, for Port Washington to respond here to the village of Fredonia, we're talking about 16 minutes for response time. If we relied on Saukville or Grafton to come up, we're talking about 19 minutes on average for response time to get here into the village of Fredonia. The volunteer numbers, going back to where I highlighted those AEMTs that I had in the previous slides. In 2017, we had 11 A-level EMT staff that provide 24/7 coverage. That's 797 hours on call annually that they had to put their name on a calendar and say, I'm going to be around if this ambulance needs to go out. This is, remember, these are all volunteers. So this is in addition to the 2,080 hours that they're working at their normal job or more. And back then in 2017, we had 274 calls. Our current number right here in 2024, we have 8 A-level EMTs. If we didn't have paramedics, the 24/7 coverage, those 8 volunteers would have to put in almost 1,100 hours of on-call time on the schedule at minimum, so that we could staff the ambulance with that A-level EMT. Again, this again is in addition to that 2,080 hours of their regular job that they have outside the community. And then we have the call volume here that we're at 456. So call volume again doubles, and the time is just huge that you're asking for commitment from the volunteers. Yes. Yep. Volunteers will be supplement to the paramedics. So the paramedics would take, I remember that those 3 spots, the paramedic would take one of those spots away, and we end up with just having to supply a driver and then one of the EMRs, EMTs, or AEMT people, which takes their numbers and drastically reduces their amount of time. I think there's another slide coming up that's going to show that's going to be like 470 some hours that they have to put on call now, which is a huge reduction, which is going to make our volunteers last a lot longer and stick around. Because this number right here, this 1,095 hours or 1,100 hours, plus the training and everything else, who has time? Who has time to do that, right? A little bit of history though on how we got to where we're at today. The fire and EMS program, in 2020, there was a study for Ozaukee County done by a company called Wisconsin Forum. They did a study that looked at every single fire department in the county at that time. The study was completed in 2021. The study noted that we had a couple things that were taxing our fire and EMS system. The number one problem was the lack of volunteers. At that time of the study, Ozaukee County was 95% volunteer-based fire departments and ambulances. Since then, it has evolved quite a bit. I mean, you have a lot more full-time people in the Mequon area. Mequon and Thiensville fire departments combined. Grafton and Saukville have hired more full-time people. Port Washington has hired more full-time people as well. The aging population is the other thing that's taxing the system here. And then the number of assisted living units and nursing homes that are in the area as well. The EMS status, the emergency medical services status, the ambulances in 2020, we had 4 paramedic level ambulance services in Ozaukee County. Back in 2020, we had Grafton, Mequon, Washington, and Thiensville. Thiensville is no more today. They merged with Mequon. And then we had 4 advanced level EMT ambulance services in Ozaukee County: Cedarburg, Fredonia, Saukville, and then Wabica. And then the Belgium Fire Department was one non-ambulance provider in Ozaki County. They do not have an ambulance. They have a first responder unit that they respond to. And then our ambulance covers them. The study did note that there needs to be some kind of collaboration. They had recommended multiple ideas on how do we form this? What does this look like for the future? They had talked about mergers of fire departments. They had talked about just staffing as staffing ambulances in critical areas, like having some full-time people here in Fredonia, maybe one person full-time in Belgium, kind of just around the county that way. They had talked about an entire county as a fire department, getting rid of all the individual fire departments and going to a county-wide fire department. So there was a lot of different ideas that this study had thrown out. In 2021, after this study was out a little while, the retired Sheriff Jim Johnson from Ozaki County had approached the fire chiefs in Ozaki County, and he had specific concerns about our response times. Jim was at a call in the village of Belgium where we needed a paramedic. Our ambulance responded to that call in the village of Belgium, but it took over 20 minutes for that paramedic to get on scene. He just said that's unacceptable. We got to do better. Okay. At that time, we had to rely on a paramedic unit from Thiensville to come all the way up because Port was busy, Grafton was busy, Saukville wasn't set up yet. And we ended up coming all the way from Thiensville at that time for that specific call. So Sheriff Johnson said, hey, we've got Ozaki County sitting on $17 million of ARPA funds that maybe we should tap into and see if they can provide some help for us to shore this up a little bit. The fire chiefs took that back. We all sat down, talked about things. Sheriff Johnson was part of those talks. And we decided that firefighter paramedics were the solution. Serves two purposes here for us. It provides paramedic level service for us here in the north end of the county and not have to rely on Port Washington and all those other communities to do it for us. And it also sets our fire department up with fire personnel for the future. Firefighter paramedics also come with different labor laws. They work 24-hour shifts. They can work 212 hours in a 28-day period without overtime. And we know that overtime kills budgets. So a straight paramedic or straight EMT is 40 hours, and then we have to pay overtime. So you look at the firefighter paramedic as being a better fix for us and a better fit, both for financially and then also setting up for the fire side and the EMS side. We talk about a lot of this as the EMS being the problem, but the fire side is right there with it. The volunteers for the fire side aren't knocking down the doors either. So in 2021, late 2021, the Ozaki County Fire Chiefs approached the Ozaki County Board for funding. They unanimously approved this grant program for us. The funds obtained from Ozaki County, though, had some requirements on it. Said that number one thing, that you had to have collaboration between communities. They weren't going to be giving it just to Fredonia to do what you wanted to with it. We had to be partnering up with other communities out there. So what we did up here was we partnered with our ambulance district, town of Fredonia, village of Fredonia, town of Belgium, village of Belgium. Then it had to contain an approved sustainability plan. So beyond the county funding. So if the county gives us $1 million, they didn't want us to fold the program up when that $1 million is gone. They used the example, one of the county board members said, they used the example of back in the 90s, there was a program that they funded a bunch of police programs. And as soon as that money was gone, those police officers were out of jobs. And they didn't want that to happen with this either. They wanted sustainability. So and the other thing was Ozaki County, since it was ARPA funds, there has to be spent at a certain amount of time. So Ozaki County funding must be spent by December of 2025. Finally, if we go back one slide, I'll show you that late 2021. Remember, we approached them in late 2021, and we got approval right away. But then in 2023 is when we first received the funds. There was a good year and a half of negotiating with the county on what it was. It started out as a $5 million grant for Ozaki County, and in the end, I think it ended up being like 1.6, 1.8, somewhere in there. Significant reduction, but Fredonia received $648,000 in grant funding for the county so that we could start our program. We upgraded the ambulance service to paramedic level here in Fredonia. The grant supported $100,000 of that 648 was for equipment needs. We were starting up a paramedic program from scratch. Other departments like Grafton and Saukville and Mequon and Port Washington didn't have those startup costs. So we negotiated with Ozaukee County to get another $100,000 so we could get the supplies we needed and equipment we needed for the paramedic. And the grant was supposed to provide full-time staffing at the firehouse through December of 2025. So again, I talked about the municipalities that work together here up in the north, the 4 of us. The joint municipal agreements, memorandum of understandings, all were approved and signed for sustainability beyond 2025. Again, those are between the village and town of Belgium, village and town of Fredonia. And so we started to hire firefighter paramedics. In June of 2023, we hired our first firefighter paramedic, Josh. And then in October of 23, we hired our second full-time firefighter paramedic, Crystal. Josh has worked in the county and has 12 years of experience. Josh has been with Port Washington for I think pretty much all those 12 years and transferred over here to Fredonia when we started up our program. So Josh has a good working relationship with our EMTs prior to coming on board here and has been around the community for years. Crystal, and Josh is also a critical care paramedic as well. Crystal came to us from Superior Ambulance. Crystal was a flight paramedic with Superior Ambulance. And she had 8 years of experience with us, or with that before she came to us in October. And then in May, we had approached actually in April, we approached the joint municipal group, which there's 2 representatives from each municipality on it, and said, we'd really like to hire more people to fill more of the schedule. They approved that. And so we hired a part-time firefighter paramedic in May of 2024. Dean comes to us from Sheboygan Fire Department. Dean is a firefighter paramedic that was in Sheboygan for 25 years. He recently retired. He retired in March of 2023 and said, I need to go back to work a year later. Dean has 30 years of firefighter paramedic experience. So another great hire.
That's a question.
Yes.
The full-time people that you hired there, are they village employees?
Yes. Yeah, everything is being run through the village of Fredonia on this program. We can give them the benefits, the Wisconsin retirement benefits, and all of that stuff, insurance and coverage all through the village. Yes. Yep. So again, current status, we have 2 full-time and 1 part-time right now. Again, the end game of this is 3 full-time and 3 part-time. When we're all done in January 2026, we will be hiring a 3rd full-time person and then 2 additional part-time. The Fredonia Ambulance is providing paramedic level care we provide a paramedic level ambulance service to the village of Fredonia, the entire village of Fredonia, and then parts of the town of Fredonia and parts of the town of Belgium. And we also provide what we call a paramedic intercept service to Waubeka Fire Department's ambulance. Couple different things. Paramedic level ambulance, our whole ambulance with our paramedic is going to grab the patient, take the patient, treat the patient, take the patient to the hospital. If we are doing a paramedic level paramedic intercept, our paramedic leaves our station in a Ford Explorer, intercept vehicle we call it, and they go to the neighboring department, Waubeka in this case. They jump in their ambulance and they go with Waubeka ambulance to the hospital and treat the patient. The Ozaukee County funding is estimated to run out, we're guessing around August of 2025. But the joint municipal agreement between the 4 municipalities, they approved to fund that deficit in 2025 and get us to 2026. We're currently working through the funding of 2026 and beyond. That is where this referendum comes into place. January 1st, 2026 is where we would be funding with the referendum money. And this carries a price tag of $510,000 annually. And we'll talk about the financials in a minute. So again, we had talked about that fire medic position. It fills one spot on that three-person ambulance crew. Again, the state of Wisconsin says we only have to have a crew of 2 legally, but that's not how we do it. And that's just for our people's safety and for better patient care. We do have a full-time advanced level EMT that we hired in 2017. She works with us Monday through Friday, 7 o'clock to 4 o'clock. We used to have 2 part-time. So prior to 2004, we had identified that all of our volunteers were working outside of the community, and during the daytime, we didn't have anybody here really. So we hired 2 part-time people at that time. They retired in 2017, and then we went to this full-time advanced level EMT from 7 until 4 in the afternoon. So with the paramedic being in our station, and then having an A-level EMT between 7 o'clock in the morning and 4 o'clock in the afternoon, we technically have a legal crew by the state requirements. And we could pull the ambulance out and go transport a patient. So no waiting for a volunteer anymore to come from their home and respond. So that's a good thing. The volunteers, again, fill the other 2 shifts. We had talked about that. Current staffing levels, we have firefighters and drivers at 13. We have EMRs, EMTs, around 18. And then that number at the bottom there, that 487 hours, that's the on-call time. Remember, we had that 1,100 hours earlier in the slide presentation that we talked about. Now the firefighters or the EMTs only have to do 487 hours. That's a huge drop. And that's going to cause what I say less burnout. You're not requiring these people to give their family time away. A lot of the young, I shouldn't say a lot of the younger, half of them have children of school age yet, and they want to attend the sporting events and do things like that and become involved with their families. I also have 3 of them that are in their 60s. So how much longer can I keep them, right? So if we can keep them at 487 hours a year, I think I can stretch them out a little bit longer. Yeah, there was that 1,095 hours. So with the 2 full-time and 1 part-time right now, we're currently staffing 60% of the paramedic schedule. The state of Wisconsin allows us to flex back and forth with what they call a flexible staffing plan for paramedics. So today we have a paramedic. Tomorrow we may not, just based on the schedule. And they work 24 hours a day. So their shift, they start at 9 in the morning, they go till 9 the next morning. The coverage, I looked at it, will improve in 2024. That 60% should go up a little bit since we first hired Dean in May. These are June numbers. That 60% was in June, from July 31st. But the numbers should get a little bit better than that. Call volume coverage, these are through July 31st, 2024. We had a total of 137 total paramedic level incidents that we were paged out for. Of those 137, 34 of those we had to rely on an outside company or, Port Washington, Saukville, Grafton to come in and take care of that. We did have 18 requests for paramedic level intercept. 18 requests, and that was 18 requests to go to Wabica for paramedic level intercept from January 1st to July 31st. We staffed 76% of the paramedic level incidents up through July with Josh, Crystal, and Dean. Here's the big number, and one of the main things that this serves, besides giving you the best care in the pre-hospital setting with the paramedics, the time that is saved, the response time. If you look at, we'll just look in a 2022 column all the way down at the bottom. I did not have, back in 2022, we weren't keeping track of what our response time was specifically in each municipality. But all calls combined, we're at 13.9 minutes. And that's takes into account we're responding to Belgium all the way over to I-43. But 13.9 minutes response time from the time we get paged from the sheriff's department, from the time our pagers go off until the time we are actually on scene in front of the patient. 13.9. If you look at the 2024 column, then all the way at the bottom, we're at 9.98 now, 9.98 with these paramedics that we have right now. That is a huge drop. That is almost a 4-minute difference in response time. That's huge. Specifically here in the village though, 2023, you see the 10.28. In 2024, we're at 6.26. So we've reduced 4 minutes off our response time. That is big. If a paramedic is here in our station, and they're on the schedule, they get the page, and if it's a serious call, 911 dispatch, when they ask all those questions, they also rate it as a 1, 2, 3, 4, 5 level for seriousness. They rank it that way. If it's a 1, it's most likely a pulseless non-breathing patient. 2 could be also pulseless non-breather. And if it's a 1, 2, or 3, the paramedics are leaving in that intercept vehicle and going straight to the scene and starting to give patient care. They're not waiting for the volunteers to come in. Volunteers will follow up later on with the ambulance and get on scene with the ambulance later on and meet up with the patient, meet up with the paramedic. So we've changed some things in how we're operating. So that 4.02, I'll put money on it right now. That's probably more around the 5 to 6 minute reduction mark right now. The full-time firefighter paramedic positions takes the load off the volunteers. I had talked, I had mentioned that many times here. It's one less spot on the ambulance schedule to fill with the volunteers. The full-time firefighter paramedic reduces the response times, as we've seen, and ensures the ambulance is staffed consistently. We have that first response vehicle, that paramedic intercept vehicle that I just got done talking about, that's fully loaded with all the equipment, medications that the paramedic needs to treat the patients. The only thing it doesn't have on it is splints and stuff like that, but he's got narcotics on there, pain meds, stuff to take care of the hearts, everything. Yes, everything. Better stuff than EpiPens even. And the paramedic provides you with the highest qualified medical providers in the pre-hospital care. It's the highest level of care we can do out in the field with having the paramedics there. Again, life-saving interventions, they administer medications for pain, ease suffering, provide comfort. Paramedics provide airway management procedures. They can, including asthma attacks, choking, anaphylaxis, not taking away from what our EMTs can do, but the paramedics just have a whole different toolkit that they can do. Intubation, cryocricotomy, putting a slit in the throat so that somebody can breathe. Just different things, different breathing treatments. Paramedics also carry, a high skill level in treating heart conditions. They've got medications. If the heart's out of rhythm, they got medications they can stop the heart, restart the heart, and get it back in rhythm again. They've got a lot of tools in that tool bag. So in the absence of not having these firefighter paramedics here, we're looking at the response time significantly increasing, going back to those 2022 response times, right? And maybe even worse than that, because, and not to put fear in anybody, but now I only have 8. In 2022, I had 11 potentially. The numbers aren't working for us with the volunteers. We end up providing a lower level of care than what's expected. And I put that in there and say lower than what's expected, because I think there's a lot of people in the community that feel that the paramedics are coming, but it's an EMT, right? It's emergency medical technician, a little bit lower level of care, but they can still provide the care, but it's not the paramedic level. And then we rely on our surrounding communities for the paramedic. And that has become historically inconsistent. We've struggled with that over the years, with relying on other communities. Other communities run into staffing issues where we rely on Port Washington. We call Port Washington as an example to provide a paramedic for us. Well, they may be out on a call and they don't have anybody for a backup. Well, then Port will put out a page and say, anybody available? They say no. 3-4 minutes goes by, then they page Saukville or they page Grafton. And it adds time to every time we got to rely on somebody else to do that. Again, we talked about the lack of volunteers. So I had said about putting the times back to 2022 or even worse than that. And then if we can't staff the ambulance because of the lack of volunteers, we end up getting it from another community, which increases the response time even further. And then we tax the other municipalities' systems as well, right? We're relying on Port Washington to provide our ambulance care, which is pre-1974, right? We're going backwards. In the right, on the right-hand corner, I've got a little piece there. Since we had Crystal, which came to us in June, right? No, Crystal came to us in October of 2023. Crystal was on 2 incidents within 24 hours of each other. It was on her shift. They were neighbors. Their driveways were right next to each other. One night she was in the one neighbor's driveway, and she ended up giving life-saving measures there. P&B patient, she ended up bringing back to life. Then within a 24-hour period, she was in the next neighbor's driveway. Same thing, P&B as well. One of them is alive today because of that, because of her being here and being on staff here and having a quick response time. The other one is not. It's not the outcome that we wanted, but that patient, from what I understand, was able to make it to the hospital with a pulse, and they ended up giving their organs to other people. So benefited people that way, but that paramedic being here quick is priceless. Rather than having to wait 10, 15, 20 minutes for that. A bunch of skills that the paramedics can do that our EMTs cannot. I'm not going to go through each one of these, but I can tell you that we had gastric decompression was done on one of our patients. We had a skid loader accident on a local farm. That was done on one of the patients, which we believe saved his life. Cardiovascular circulation skills, EKGs, ECGs. Our EMTs can do that, but they have to send it to the hospital. And then they got to wait for a cardiologist to read it and then come back to us and say, this is what's going on. Paramedic can interpret that. They can read it. They can interpret it. They can give the medications right away. Boom, done. Medication administration routes, a couple different administration routes for medication compared to what the emergency medical technicians can do. Medicated IV fluids. Emergency medical technicians cannot give medicated IV fluids. They have to give the medications through a shot, but the paramedics can do it through IV. And then medications there that they all have available to them for different things. A lot of these have to do with the heart, but we also got pain medications here. I don't know any of these. I know some of them, but I shouldn't say I don't know all of them. So planning for the future. So 2024 right now, we have the 2 full-time, 1 part-time. In January of 2025, the joint municipal team had said that we should hire another part-time person. So we would have Josh, Crystal, Dean, and then we would hire another one in January 1st. And then in 2026, moving forward, we would get this set up so that we'd have 3 full-time, 3 part-time. We can staff with 3 full-time. We can staff with 3 full-time 24/7. However, that doesn't allow for any vacation time or any time off. So that's where the part-time people come into play. They'll fill in for the vacation time and the time off that our full-time people need. Finances. So the expenditures, the majority of this is wages, benefits. Again, 3 full-time, 3 part-time in 2026 is going to cost us, we're estimating $510,000. Paramedic wages, insurance, health insurance, WRS, Social Security, medical supplies, training, uniforms, gear, intercept response vehicle maintenance. This program is only being funded. This program or this referendum is only funding the paramedic piece of it. It is not providing for the ambulance. It is not providing any money for the ambulance. It is not providing any money for the EMTs or anything like that. It is only the 3 full-time, 3 part-time, and anything that has to do with the paramedic level service that we're providing. The capital expenditures, 10-year outlook, we're looking at approximately $100,000 over the next 10 years that we would be looking at for capital expenditures. The number one thing we have to do is when we get these 3 full-time and 3 part-time is get sleeping quarters down at the firehouse. Right now, currently, we did in 2018, we did renovate and move into a newer firehouse. We have a storage room that we need to convert into sleeping quarters. We currently have them housed in a closet, sleeping in a closet. It's a small office. It's a small office, but we need to get them out of that and get them into something that's more decent. And then we looked at 10 years out, we would replace our defibrillator, heart monitor that we purchased, and then potentially that intercept vehicle that we purchased. We purchased a used Ford Explorer from EVS Ford, just because of the money. We wanted to do it the right way. Again, on paper, this is budgeted out until 2036 with a 5% escalation. But we can't really forecast out what the actual expenses that far into the future based on insurance rates and things like that we were going. So, but we're giving our best guess right now. So these costs, that cost are split on 3 different things. First of all, it's between 4 municipalities. And then each municipality is their percentage is based on the call volume, the equalized value, and then the population. So the Village of Fredonia's portion in 2026, we're looking at $175,000. Belgium is around $150,000. Town of Belgium is like $104,000, and the town of Fredonia is like $98,000. So just so you have some kind of understanding of where everybody's at and what their piece of the pie is. The referendum question is going to ask voters to increase the levy by $175,000 to $200,000 per year to cover the Village of Fredonia's portion of the program. What does that cost? That's about $70 per $1,000 of assessed value. So home valued at $350,000 is about $245 a year, $470 a week. No. So next steps, the Village of Fredonia and Village of Belgium have to go to referendum. The town of Fredonia and town of Belgium, they do their annual budget, and based on their population, they can just hold at their electors meeting, do a vote on it there, and they can pass or fail it there. But the village and town, based on their population, has to do a referendum. You were given frequently asked questions. I do have frequently asked questions up here that we can hand out to everybody. I have a bunch that are listed here that we're not going to go through, but I can give you a handout. Any questions at all?
Ryan, you said that over the 10 years, our calls doubled. I think you mentioned one of the reasons why is because of aging population. Was there any other factors in that?
No, it is aging population and the assisted living homes that have gone in Fredonia over the last 10 years. We had none, but now we have Woodland Hills, which is down on South Milwaukee Street. We have the home up here on Martin. And then there's a couple other ones too that are just in-house. We have one up on Lawrence, and we have one also on North Wilson Street.
And I would just add the reliance on emergency services as medical care, right? There's so many
That's true,
people
too.
that unfortunately call 911 as opposed to just going to the doctor.
Yeah,
Sometimes that's their only option.
correct. Any other questions at all?
Right, it's not much, it's more just a statement. I've been on South Milwaukee Street for about 35 years now, you know that.
Yep.
I live 110 South Milwaukee, so probably about 90% of your calls come past my house. But I noticed like 4 to 5 per day sometimes, it can be as much. And sometimes not as much, but I noticed a lot of the times, like you had mentioned, the paramedic is the first vehicle that I'll go through. And then they'll follow my ambulance and everybody try to get something, you know, something more. But I think that's huge, and that's something that I think we definitely need in Fredonia. And I'm 100% favor of whatever we gotta do to keep these people here and recruit the new people that we need. I just think it's priceless, you know, for what kind of life saving they can do for any loved ones of somebody. And I think it's a great thing that you're doing this and showing this, and I'm 100% behind it, you know, so I just want you to know that.
Thank you. Yeah, it has been a huge burden off of the volunteers. Kim and Joan Steffen have a son on the department, Kyle. He's been doing it for 26, 27 years now. He's been around a long time. And Joan had mentioned to me the other day, she says, it's so appreciative. She said, I call Kyle to come and actually do something, and he's free. He's not on ambulance duty. She said, so I'll support you whatever you want. But yeah, it does. It takes the burden off of the EMTs. They don't have to be on call or be listening for that pager all the time. They can have some time themselves. You know, the quickness in response, I know that Belgium is watching the numbers as well with that paramedic response vehicle leaving and going out first. We're able to make it over in Belgium in about 6 minutes. We're very comparative to their on-scene time, which is huge, right? If we can get on scene at the same time they do, that's awesome to have that paramedic there. Then our ambulance gets the volunteer EMT, the volunteer driver, they get in, they respond a couple minutes behind, but at least the care is there that they need, so. And here, you know, they're living in our station, so I hate to say it, but Fredonia gets the best of this world by having them here. You get a 2-3 minute response time potentially with them getting up, you know, if they got a worst case scenario, they got to get up out of bed. Most of them, they all sleep in their clothes. So they're just getting up out of bed, getting their bearings straight, finding out where the address is, getting in the vehicle and taking off and going. So it's quick. It is an expense, and I know that everybody, you know, is concerned about the cost of it, but I think it's something that if we don't do it today, it's got to be done at some point in time because the volunteer numbers are just dropping.
What kind of costs to put it away?
Well, that's true too. That's true. You know, this isn't, we say that in 2020, we did this study and everything, but I can tell you that the 3 fire departments here in the north end of the county, Belgium, Wabica, and Fredonia, have been working together for years. But over the last 4 years, we went to a thing called simulcast page now, where if there's a known structure fire on the fire side of things, if there's a known structure fire, we're all 3 getting paged at the same time, and all of our vehicles are leaving and heading to the call. The other night, we had a call here on Fredonia Avenue and South Milwaukee Street, right on the corner, and all 3 departments got paged because it was a known structure fire. So we have adapted to the number of volunteers, you know, where we're at with volunteers and having decreased number of volunteers. We've adapted to, okay, what can we do to still get the response that we need and get the resources there that we need right away? So it's not only the fire side, you know, it's not only EMS side, it's the fire side as well that we've been working with. So we also have same medical directors. Belgium and Fredonia have the same medical directors out of Aurora. So we train together all the time. We are working with Wabica right now to look at doing the same thing. And then if that happens, then we start talking about cross-licensing our EMTs. EMTs are licensed on our ambulance, we're licensed on their ambulance, and we can work together as well that way and try to make things work. Because Wabica ambulance, if our ambulance is out, Wabica ambulance is the backup up here. Correct. Yes, Wally.
I guess I kind of do a little bit about what's happening in the EMS services. It's about 50 years old. It was welding. When it started back about 50 years ago. And I developed work training. I mean, if you get it all of those. And also I was with the fire department. I took my training down and walking the police and fire academy. The whole mindset changed. But down there, when I first started there, part of the service was there. And they said, they did not want to be a part of it, but they were chosen by the chief to go ahead with it. They were part of the fight. I think the tide has changed hopefully. After we see the facts today, because 60% of calls are medical related, has to have some of the barrier. My question would be, this is check and balance system. I'm a firm believer in a check and balance system here. That we need a commission of some sort of equal representation from all communities there on the staggered permit. What that is, we have no continuity. Usually we have continuity. To make a point, take a look at yesterday's term, I think something, I think this is the Department of Natural Resources, they got an advisory board on here on. I guess they got a 7-year term, but it needs continuity. If there's a problem, and we can solve them on that level, rather than go up the ladder, I think it's real great for the success of the organization.
Yeah, the joint municipal group has 2 representatives. I don't know if you heard that. I don't think you were here before, but the joint municipal group has 2 representatives from each community. So 2 from the representatives of the town of Fredonia, 2 from the town of Belgium, 2 from the village of Fredonia, 2 from the village of Belgium. And so there's 4 of us. So every year we have to, this paramedic would have to present, this paramedic program would present the budget to that group. That group okays it, and then they bring it back to their individual boards for approval. So there's big oversight on it, and there's no one person that's got total control over it. We're just running it through, again, the village of Fredonia, because it allows us to be competitive with the retirement and the benefits piece of it. We did, when we set this up, we did go through, and what I did do is go through and check out all the other communities around us were paying, and so that we're appropriate pay scale. I didn't want a revolving door that everybody comes in here at $10 an hour and they're out of here because they're making 12 down the road. So we set it up that both myself, Fort Washington chief, the Grafton chief, we all have the same pay scale. They are. Okay, any other questions? If anybody has anything, please reach out. So I'm not very certain.
Thanks, Brian.